Blood pressure is the force of blood moving through arteries as the heart does its job. High blood pressure, or hypertension, is when the level of blood pressure is so high that it requires treatment. Hypertension is a risk factor for heart attack, stroke, and other diseases. There are some things you can do, however, to prevent and treat this serious health condition, regardless of your family history or genetics. Blood pressure is measured with a device that uses an inflatable cuff around the arm. When healthcare providers measure blood pressure, they are measuring two things, each of which is given a number. The top number is the force of the blood against the artery walls when your heart beats, measured in millimeters of mercury, and this is called systolic blood pressure. The bottom number is the force of blood against the artery walls when the heart is at rest, and this is called diastolic blood pressure. Among healthy people, the lower your blood pressure, the better. A desirable systolic blood pressure is less than 120 millimeters of mercury, and a desirable diastolic pressure is less than 80 millimeters of mercury, corresponding to a blood pressure reading of 120 over 80. The level of blood pressure used to diagnose hypertension varies by country. In most countries, a person is not diagnosed until the systolic blood pressure is greater than or equal to 140 millimeters of mercury, or the diastolic blood pressure is greater than or equal to 90 millimeters of mercury. Other countries use a lower threshold of 130 millimeters of mercury over 80 millimeters of mercury. In either case, someone with a blood pressure greater than 130 over 80 has elevated blood pressure and should take steps to lower it. High blood pressure damages the arteries, similar to how high water pressure over time damages plumbing in a house. When the arteries that bring blood and oxygen to the heart are damaged or blocked, the heart becomes weak and injured. This is called a heart attack. If a similar process happens in the brain, it's called a stroke, and in a matter of minutes, a person may have difficulty walking or talking. Heart attacks and strokes dramatically change people's lives and impact both patients and their families, who are often left to care for them. High blood pressure is often silent, meaning that most people don't have any symptoms at all. Someone could have untreated hypertension for years before ever having a heart attack or stroke. Most adults develop high blood pressure at some point in their lifetime. Because many people don't get their pressure checked regularly, they don't even realize that they're walking around with an increased risk for disability and death. This is why it's essential to have your blood pressure routinely monitored by a healthcare practitioner. There are several things you can do to keep your blood pressure in check. First, if you have a high blood pressure reading, you should have it rechecked by your healthcare provider. Some people also choose to use a store-bought monitor to check their pressure at home. Second, if your healthcare provider prescribes medications to lower your blood pressure, it is important to take them consistently, even if you feel fine. Third, make small changes to your lifestyle to improve your blood pressure. Having a healthy diet, eating less sodium, increasing your physical activity, and managing your weight are all healthy behaviors that have been shown to lower blood pressure and improve health. Through this video series, we will introduce practical steps you can take to incorporate these changes into your everyday life. Okay, let's summarize. Blood pressure is the force of blood moving through the arteries. A systolic blood pressure of greater than or equal to 130 or a diastolic blood pressure greater than or equal to 80 millimeters of mercury deserves attention. Keeping blood pressure low is critical to preventing health problems like heart attack and stroke. There are steps you can take to keep your blood pressure low. Have your blood pressure monitored routinely, take medications if prescribed by your doctor, and take charge of your diet, sodium intake, physical activity level, and weight.